Good day, everybody. We are Group 1 and we are here to discuss about hydrotherapy or also known as aqua therapy.
So for the first topic we will discuss about aquatherapy is the physical properties of water. So water has a number of physical properties that make it well suited to a variety of rehabilitation applications. So one is solvent. So running water over the body or over an open wound will remove some contaminants or necrotic material. It will make the water dissolve fatty material that is hydrophobic. So another physical property of water is its resistance. Debriding and cleansing wounds, water speed can be adjusted to exert variable pressure against the wound bed. So for hydrostatic pressure, this is a pressure exerted by a fluid on a body immersed in it. Immersion in water can promote circulation or alleviate peripheral edema caused by venous or lymphatic insufficiency. Again, for hydrostatic pressure, it is the greatest effects will occur in the vertical positioning with the feet immersed most deeply. So for buoyancy, buoyancy is a force experienced as an upward thrust on the body in an opposite direction to the force of gravity. So exercising in water takes advantage of the buoyancy of the human body. For specific heat and thermal conductivity, water can be used as superficial heating or cooling agent by conduction or convection. So the ability of water to transfer heat rapidly and efficiently is one of the advantages of performing exercises in a swimming pool that is cooler than the patient's body temperature climate. With the physical components of water, so it has physiological effects to the body. First is the cleansing effects. So water or hydrotherapy, it helps pressure to remove debris and dissolve surfactants and antimicrobials to assist with cleaning. It also has effects on the musculoskeletal, which is decreased weight bearing, strengthening, effects on bone density loss, and less fat loss than with other forms of exercise. Next is the cardiovascular. Hydrotherapy increases venous circulation, increased cardiac volume, increased cardiac output, decreased heart rate, systolic blood pressure, and rate of oxygen uptake response to exercise. Next is the respiratory effects. Hydrotherapy decreases vital capacity, increased work of breathing, and decreased exercise-induced asthma. So it has also effects on the renal. So it helps in diuresis, increased sodium and potassium excretion. So lastly, hydrotherapy has psychological effects on the person who is having exercise in the water. So it helps relaxes or invigorates them depending on the temperature of the water.
Next is contraindications of hydrotherapy. As all we know that every treatment has its contraindications. Here are the following. First is cardiac instability. So it is very common or specifically with patients with hypertension or heart failure. Heart may be unable to adapt sufficiently in response to the changes in circulation and it produces hydrotherapy to maintain cardiac homeostasis. Next is confusion or impaired cognition. Due to the impaired cognition, it is the risk of drowning is increased. So it is needed with direct supervision of the therapist. Next is skin graft. So graft may not tolerate high levels of mechanical agitation or may not have a sufficient vascular response to compensate for extreme heat or cold. Next is bleeding. So it may increase bleeding by promoting venous circulation through hydrostatic pressure. It also increases arterial circulation as a result of vasodilation. Another one is infection in the area. So patients with infectious conditions may spread the infectious disease in the water. Next is bowel incontinence. So to avoid contaminating the water, thus the wound with bacteria from the patient's own feces. So urinary incontinence, so it also increases the risk of UTI infection in a catheterized patient. Next is severe epilepsy. The patients are at increased risk of drowning. Another is suicidal patients. Impaired thermal sensation. So areas with impaired thermal sensations have an increased risk for burn. So the therapist needed to check the temperature using the thermometer. Next is limited strength, endurance, balance, or ROM. So extreme limitations in any of the list of these possesses a safety hazard for full body immersion hydrotherapy hydrotherapy. Fear of water. So if the patient has its fear of water, it will refuse to participate in immersion hydrotherapy. Next is respiratory problems. So it is common with patients with asthma that it may be sensitive to chlorine and other agents used to decontaminate exercises, pools, and whirlpools. Next is pregnancy. So maternal hyperthermia has been found to be teratogenic and is associated with a variety of CNS abnormalities in the child. So adverse effects of hydrotherapy. These are the list of adverse effects.
The following topics will be discussed in this part. So, general hydrotherapy procedure. So first, we do the evaluation of the patient and set the goals for treatment. We then determine whether hydrotherapy is the most appropriate treatment for the client. And we also need to determine if hydrotherapy is not contraindicated for this patient or this condition. We also select the appropriate form of hydrotherapy according to the condition. And we need to explain to the patient the procedure. The patient needs to know what to expect from start to finish of the treatment. The patient also needs to know the reason for applying hydrotherapy and the sensations the patient can feel, what to expect during the treatment. We then apply the appropriate form of hydrotherapy. When hydrotherapy is completed, we assess the outcome of the treatment. And the last part which is one of the most important part of the whole guidelines, all the procedures, we need to document the treatment. So next is the non-immersion irrigation and pulse lavage. So for the guidelines, we need to use a private single patient room containing only the essential equipment. This is to prevent contamination and infecting the wound. So surfaces at risk for aerosol contamination should be covered with a drape or a towel. During the treatment, the clinician and anyone else in the room must wear full personal protective equipment, including the patient. And then after treatment, all surfaces touched by hands must be disinfected. So to maximize comfort and optimizing healing, we need to use clean, warm fluid should be used for irrigation. Treatment be applied daily for long enough to hydrate hard eschar or loosened debris. Frequency and duration of treatment will depend on the size of the wound and the amount of necrotic tissue, exudate, or other debris present. So NPWT, or the negative pressure wound therapy, is used for deep and large wounds. It speeds up healing process and controls swelling and infection by offering a quick and safe wound closure. Typically, the client wears a device for 6 to 8 weeks, or depending on the healing of the wound. So this is used in conjunction with non-immersion irrigation of wounds to promote wound healing. So NPWT involves applying a continuous or intermittent negative pressure over the wound bed and using a filler dressing, a covering dressing, and a pump. So it uses a machine to aid in the healing of the wound. For the procedure, we need to first respect pain. So we need to pre-medicate the patient as needed and as prescribed. So we prepare the wound by removing the prior dressing very carefully to avoid tissue damage and bleeding. We debride the wound formed by a qualified practitioner. We do the cleansing of the wound as needed or prescribed, and we do assessing of the wound size and depth. After preparing the wound, we cut the foam dressing to size and place into the wound. The trim clear occlusive dressing to size, peel back one size of the layer 1 and 2, and place adhesive side down over wound. So we then cut a hole on the clear dressing about the size of a quarter, and then place the pad and tubing directly over hole, affixing it to the clear dressing. Connect pad tubing to canister tubing and be sure that the clamps are open. And lastly, we turn on the vacuum device, set the prescribed pressure settings, and confirm that the dressing and foam shrink down. So lastly is the exercise pool, which is the most commonly used form of hydrotherapy. So for the procedure, the patient and the therapist should wear breathing suits or of the appropriate clothing for pool exercise. The patient then should help, the therapist should help the patient enter the pool if necessary, So they need to provide ramps, stairs, a ladder, or a lift when needed. The patient may perform activities to improve strength, cardiovascular fitness, endurance, or functional activities as determined by the evaluation and plan of care. So activities may include upright exercise, walking in the pool, swimming, and other forms of exercise. The patient may use flotation devices, a tether, or other objects to alter resistance or the buoyancy effects of the water. So the therapy should stay with the patient throughout the treatment and should monitor vital signs during the exercise. And lastly, after completion of water exercises, the therapist should help the patient to get out of the pool if necessary.
Next, I will be talking about the safety issues related to the use of the pool or any other hydrotherapy equipment. So, safety precautions include first safety. The personnel should be trained in the use and hazards of the chemicals used, such as chlorine and bromine, and they should also wear protective gear when in contact with these hazardous chemicals. The staff should have life-saving and rescue training and knowledge of personal water safety. And then very important is that the staff should be CPR trained and certified. Safety in and around the pool. So the areas surrounding the pool should have non-slip surfaces. And then next is the pool should also have stairs, ramps, ladders, or lifts for non-ambulatory or impaired patients. Another is that the pool should have hand grip bars around the edge, and in order to assist patients when they lift themselves up from the pool. For the emergency equipment, it should include the following: the shepherd's crook. The picture on the left side is the shepherd's crook. Next is the rescue tube, which is in the middle, in the center. On your right, that is a rescue tube, and then on the lower left, that is the rescue. Those are resuscitation equipment, which also includes the AED. And then the emergency equipment should also include the spine board.
So for the target population, we will be discussing about the wound care, the water therapy, and the superficial heating and cooling effect of hydrotherapy. So for the wound care, hydrotherapy is actually used as to accelerate the healing of like opening wounds. So it includes like wounds that is caused by diabetes or like pressure or vascular insufficiencies or burns. So it can be used in the care of wounds, especially when the patient is from like trauma or surgery or like abscesses, like they have cellulitis or they have like that necrotizing fasciitis. So it is also used to cleanse and like because it has like a cleansing properties that facilitates like rehydration and like softening and debridement of necrotic tissue. So it also helps like remove like exogenous wound debris, and the hydrostatic pressure of water immersion and the heat of warm water can also improve the circulation. So the use of hydrotherapy is very consistent with the current understanding that the wounds heal better when they are kept moist rather than being dry. So right now, the wounds are treated in Whirlpool. When we are using Whirlpool, there is actually called a Whirlpool liner, which helps reduce the risk of contamination and infection. Because when we use the hydrotherapy during our treatment, there's a high risk of infection. So that's why we need to use Whirlpool liner if ever we are using Whirlpool. Next is the treatment for wound care. Actually, there's a immersion hydrotherapy, which was already discussed a while ago, but we will now proceed to treatment of burns. So for the treatment of burns, it's actually used during the early and like the late like stages of burn. So for the early stage of burn, it is used to cleanse, to soften and loosen the necrotic tissue before the debridement, and it is also used to reduce the bacterial load. So for the late or the like after the burn phase, so it's also used for re-epithelialization, and it is also the risk of like wound care is eliminated in these situations because The water here is used to provide a comfortable environment already for the patient. So this is the time that we will do ROM exercises, and it can also help during AROM and PROM to help like prevent like malcontractures or like facilitate the increased ROM in the scarred areas. Okay, next is the negative pressure wound therapy. So, or it's also called vacuum assisted wound therapy. So NPWT involves like creating a vacuum over the wound bed that is filled with the dressing. So it is applied with a controlled suction to force the wound through a filling dressing covered with an impermeable membrane that seals the wound. NPWT is thought to aid like wound healing because it provides like a moist wound environment, and it removes the interstitial fluid, and it exudates and decreases the edema. So it facilitates the perfusion and like formulation of granulation tissue. So it is involved in the wound healing as well. NPWT is actually used for those who acquired acute and chronic wounds, especially those who has like venous ulcers, which are like stages 3 to 4 na, and stages 3 to 4 of pressure ulcers that fail to heal with standard like wound care. So they resort to NPWT. So as we know, hydrotherapy is also used for edema control. So for edema control, the water immersion can reduce the peripheral edema because of the effect of the hydrostatic pressure of the water in the circulation and the renal function. So that's why it is good to use hydrotherapy for edema control. It also treats the peripheral edema with a variety of causes like venous or like lymphatic insufficiency, renal dysfunction, and post-operative inflammation. So the cooling effect of hydrotherapy also helps to reduce edema or to further reduce edema because it uses or it has like it causes a vasoconstriction and vascular permeability. So next is water therapy. So in the water therapy, so there are a lot of types of exercises in water therapy. So it includes like swimming, running, with or without the vest or belt, walking, cycle, ergometry, and other like forms of upright exercises that can be performed in water. So there are two types of exercises in the water. First is the closed chain and the open chain exercises. When we say closed chain exercises, these are exercises performed in shallow water. So using the bottom of the pool, it is to fix the patient's distal extremity or like the side of the pool to like fix the distal extremity when the patient is in deeper water. So open chain is performed in either deep or shallow. So it depends on the area of the body involved and the type of exercise to be performed. So what are the specific uses of water exercise? So there are actually a lot. So there are 5 highlighted, which are orthopedic rehabilitation. So for orthopedic rehabilitation, it is used to decrease like weight bearing on the joints. It is used for like velocity dependent resistance. It is used for closed and open chain exercises. It is also used for high fibromyalgia and like effects on the bone density loss. For neurologic rehabilitation, it is used as a proprioceptive input, increase safety, improve balance, cardiovascular fitness, cardiac conditioning, patients with poor tolerance for land-based exercise. So that's why they are in the water or swimming pool. So next is pregnancy. So pregnancy is since pregnant women, they usually like have difficulty balancing. So it also decreases like the weight bearing for the pregnant women, and also like less elevation of heart rate with exercise, and also like decreased risk for maternal hyperthermia because they're in the water. Next is exercise-induced asthma. So this is like a less exercise induced compared to the land exercises. So age-related deficits, so improved balance, improved strength, improved cardiorespiratory fitness, and improved functional mobility, since the elderly usually has these types of deficits. And the last is the superficial or heating and cooling. So water actually provides the perfect contact with the skin. So even like the contoured area, so it doesn't have to be fastened to the body. It just like allows movement during heating or cooling. So that's why it's also good as a superficial heating and cooling.
For the literature review, we chose the journal entitled application of hydrotherapy on the intensity of pain and quality of life among arthritis patients. So this study was done by Root et al. In India. So hydrotherapy has been used from ancient periods and is a cost-effective therapy for pain and inflammation. And for the objective of this study, the researchers wanted to investigate or to evaluate the effect of hydrotherapy on the intensity of pain and quality of life among patients with arthritis. So the design of this study was a quasi-experimental design. So for this study, it involved arthritic patients who lived in urban slum areas covering Bhubaneswar, and their age ranges from 30 years old to 70 years of age, and they all volunteered to participate in the research study. As mentioned in the study, the sampling technique was non-probability purposive, and for the method of the study, there were three different processes. So first is the patients or the participants rather were asked to fill out the self-structured socio-demographic questionnaire, which is basically just to get their information, their age, their marital status. And the next is the self-structured modified arthritis quality of life scale. So they fill that out. And then lastly is the visual analog scale to determine the pain levels of the patient. For the sample size, 60 samples in the control group were, 60 participants were assigned to the control group and the other 60 were assigned to the experimental group. And the study was done for 2 months, and then another follow-up treatment was done on the third month, wherein the researchers also re-evaluated the patients and gathered more data using the same outcome measures. The result of the study showed that hydrotherapy was effective to enhance the quality of life among arthritic patients. And based on the results of the study, the researchers recommended that a similar study should be done for higher analysis by using the randomized control trial design. These are our references. And that concludes the presentation today about hydrotherapy or aquatherapy.